Hi there, my name is Dr. Kimberly Ernest, and today on the How to Be Happy Hour, we will be talking about all of the different pieces that go into an effective supervisor-supervisee relationship. I've personally been able to be a supervisor for about the last 15 years. Prior to that, and even subsequent to that, I have been in my own licensure supervision at different points in time. I also serve as the president of Pennsylvania Counseling Services, the founder of Live Up Counseling, and maintain a dual license as a clinical psychologist and licensed professional counselor in the state of Pennsylvania.
Hi, I am Kristen Wortluft. I'm a certified advanced alcohol and drug counselor, a certified recovery specialist supervisor, a certified family recovery specialist, and I've been in supervision what seems like my whole life. And I've been a supervisor, I think, for about 6 years now in this role.
I'm Mal Morgan. I am a LPC in the state of Pennsylvania, as well as a certified family-based therapist. I have been in supervision, also feels like my whole life, and continue to seek supervision, as well as I'm a supervisor for our Berks County family-based program.
I'm Teron Townsend. I have my MSW, and I have been a supervisee my entire time in this field.
So, y'all, as we get started, I'm curious about the role that supervisors play in the development of clinical identity. When I think about the course of my career, like all the different decision points and all the different intersecting ways in which things could go different, and I think very specifically about starting in this field as I began my career as a TSS, a therapeutic support specialist. It's not even a role that exists anymore. We've changed the name and added more initials to it. It's still technically around. I had a wonderful supervisor in that role, as my MTBC was great, and she supported me in a whole host of different ways. And then from that point, we went into a different direction because I was bored to tears of being a TSS, and so ended up doing a lot of forensic work and working with those in the process of community reentry for sexual offending behaviors. And I feel like that was a point where I had to rely so heavily on my supervisors because it was such a hard pivot from that one-on-one aid to a very different content area, and the different challenges I encountered, plus that increased risk and liability that comes with serving such a high-risk population. And I remember during that season, one, crying a lot, and then two, just kind of looking around and thinking, like, how am I qualified to do this? I am not even remotely qualified to be taking this on. How do I figure out what my professional identity is? Why is no one watching me more closely? All the different things, and just that imposter syndrome that's so inherent in the early career professional. And truthfully, what I've discovered is that imposter syndrome often grows and evolves as you grow and evolve. But what is the role of a supervisor that either y'all have had in your own supervision journey or that you've served in the lives of others to support them in overcoming that what the fuck am I doing, and really feeds that development of an individual supervision or clinician identity?
I would say I've had many supervisors along the way who I think each kind of pulled a different string for me. And so when I started at PA counseling 10 years ago, I started an outpatient and I had a very similar experience. I was like, wait, you're gonna leave? You're gonna close the door? And like, I'm gonna be in here with this person? And like, how do you even know what I'm doing? And then I started working with my LPC supervisor at that point in time. And that supervisor really challenged me in a lot of different ways and challenged me through like my imposter syndrome. Gave me really great resources, challenged me in supervision. Like, where does that thought come from? Where does that thought come from? and kind of pulled those pieces. And then when I moved into family based, I have an amazing supervisor that I still reach out to when I'm in crisis. And I just saw my own identity develop and really grow. I had some life changes in that point in my life as well. And so I was moving into like my own family dynamics, trying to figure out my own life. And another moment of imposter syndrome came up for me because I was really kind of stuck in this, like, as I'm trying to find my footing, I am trying to help this other person find theirs as well. And just my supervisors really played this important role in tapping into my strengths. And I think that that's something that I really value as like a supervisee, and then I try to do as a supervisor for my supervisees.
Yeah, I definitely have to agree. Same thing when I started here. I was like very confident about the addiction work stuff. But then they're like, you're going to be running co-occurring IOP. And I was like, oh, wait, though. Can I do that? Am I going to like not do that very well? But I was more confident about that than seeing kids. So when I found out I would have to work with kids too, I was like, you're going to let me be around children. But my supervisors all kind of had the same thing, like, you're going to be fine. And I was like, if you say so. And I believed them, and I was fine. And it's gone great ever since. And I did great in co-occurring IOP too. So just that confidence building, I think, is so important. And like, to your point of like giving that to our supervisees as well when they don't think that they're doing a good job or they're struggling with imposter syndrome, just giving them that vote of confidence. Like, no, we see something in you that you might not see in yourself yet. And you got this. You definitely got this. Yeah.
I filled out licensure paperwork for one of my supervisees not that long ago. And in doing so, I realized that it was like I've filled that specific set of documents out now in the last 14 years in some form or fashion for over 50 clinicians. And the one thing that felt so salient in doing so is that while every single one of my clinicians that I've supported or supervised or done internships for, licensure supervision for, or even like covered like a season while someone was on maternity leave, all those different pieces, because I save it all into one folder. What I discovered is that while every clinician and context and strengths and challenges and growth edges have all been very different, I can recall a time with almost every single one of them where they're like, I don't know what I'm doing, and you shouldn't let me do this. Like I almost on repeat, and it looked different for like someone would present really confidently, but then as we get into it, they're like, if you really knew, you would fire me. And then other folks would come in like a puddle, and they're like, I don't know what I'm doing. But like, so it would look different across different supervisees, but a constant has been this. Are you kidding me? Why am I not having greater levels of supervision? And even then, like, I think we provide quite a bit of supervisory oversight here. We are always encouraging you to film your sessions. We're always challenging you to attend both group and individual consultation and use those really effectively. But that imposter syndrome piece seems to be the constant theme across every single very diverse supervisee I've ever had. And I just find myself wondering, is there a way we can address that more globally, or is that just like a rite of passage in entering into the helping professions?
I think the authenticity that I've experienced in my supervisee role has been something that has helped with that. Just like my supervisors haven't been afraid to be like, me too. Sometimes I don't know what I'm doing. And I think that just is I just remember being like, oh, okay. So like, I don't have to have my shit together like all the time. I don't have to be perfect here. And I think that's an important message. I do a lot of training with new clinicians. And I think that's one of the most important messages that I try to, pass down through the generations of supervision, is that you don't have to be perfect to like instill hope in others.
I would say I feel as though kind of it is like a rite of passage, because I feel like it allows those questions to flow. Like, am I really doing what I'm supposed to be doing? And then it allows your supervisor to give that input of like, hey, no, I don't know what I'm doing all the time, and we're in the same boat. So for me starting out here as an intern, I had so much supervision, and it still felt like it wasn't enough. And I was like, all right, now I'm no longer an intern. And I still feel the same way. I still have so much more knowledge. And I truly do just feel like it's something you go through, and it just helps you see that, you won't be perfect. When you become a supervisor, you won't be perfect. As a supervisee, you won't be perfect. That perfection isn't the thing that we're striving for.
Yeah, I like the that humbles you, right? You come out of school, you have this shiny new degree, you got a 4.0, and I truly tell my supervisors, I'm like, throw that shit out. It's
Bees get degrees in
Right.
community mental health.
yes.
The county funding office will humble you.
Ew.
But like there's a level of just like life experience. There's a level of sitting in some of the darkest places with some of your clients, sitting with clients who cry, sitting with clients who have celebrated a huge win, and really being able to show up in like that authentic way. I think that that's not something you can learn in school. You can't learn that through those like mock, therapy sessions and group sessions. So I just think that authenticity and the ability to just humble yourself it is like, yeah, rite of passage.
Yeah, I remember in grad school, and it's been a while now since I graduated, but my hope is that they've shifted at least some of the way in which we train to show a greater, like a more diverse set of clinical skills. I remember when I was in grad school, you'd get to watch the masters. So I'm watching like Irvin Yalom and Virginia Satir and Aaron Beck, and they are working with oftentimes like higher functioning clientele. They're working with family systems that can at least pretend they have it together within the space. I mean, oftentimes I'm like, those are paid actors. None of those were real. But they display like these examples of like how therapy should go when it goes right. And then you get into real clinical practice and you recognize how infrequent you like administer a therapeutic, like an evidence-based therapeutic intervention, and they come out of left field with a response that you never saw coming. And I think for a lot of our providers, it's bridging that gap between the book knowledge and the theoretical emphasis of how this work is done, and then in clinical practice, how you really do it with a certain percentage of real humans that are out there in the world, and how many of our clients have not read, nor do they seek to emulate the books that we read. And so it looks so much different in real life. And I think the only way out is through. I think the only way to learn what to do in those scenarios is to have those moments in those scenarios where you're like, what am I doing? And you go talk to a supervisor or a colleague, and you seek support and you seek consultation and you figure it out along the way. And that sounds difficult in a field that we're in, but I think it's the reality of it.
Yeah, I agree.
I think it creates a human relationship, though. And it makes, like, the clinician, whatever systems you're working with, it just shows that we're human, too, and we're not expecting them to be perfect. Because a lot of, at least my clients, come with this, like, I have to make up for so much of my past, and in order to do that, I must be perfect. And that pressure just can take them back out at any given time. So I think just showing up as a human in that space, and like, no, we're all human and we all do things and we all struggle and we all, it just creates that relationship, I think, to the next level, which it isn't taught in school, but we don't have to follow a book perfectly to get the relationship, which is, some of the most important things that come from the work we do.
Yeah, I think it's like a pouring down. So when, as like a supervisor, when I can show up and in my true self and share struggles, challenges, sit there and go like, I have no idea, but we're gonna figure this out together. Just those moments where you're like, just when you thought you've experienced everything, and then you get that phone call or somebody shows up to supervision, you're like, okay, here we go. And so I think like then our supervisees can then pour that down into the families where they can show up in a more like regulated way and feel like they have a level of connection because they're getting that connection from their supervisor. And so being in both of those roles, I've had some cases where like I call Kim and I'm like, I don't even know. Like, I don't even know.
I love those calls. They're so fun. I mean, it's like, wow, that is a pickle. Let's unpack it. What are we going to do?
Yes. And then just, that like going back to that confidence thing. And so then it's like I show up and I'm able to show up regulated, even though I know that it's probably going to cause some dysregulation in the session. I'm dysregulated and I'm causing some increase in intensity. Then I know that we're probably going to not land this plane very well. But if I show up and I'm regulated and I say the hard things, sometimes we have some turbulence on the way down, but we usually land pretty well.
I think that's like such an important part of the role as supervisor for like my supervisees, but also what I've experienced in supervision is that like I'm allowed to be dysregulated in supervision. That way I can show up for my supervisees or my clients regulated. And just, you were telling this story about calling him. I just remember when I first started, I was still in startup and I went into my supervisor's office at that time and I was like, oh God, what do I do? And she was like, we're going to call Carl. And I was like, oh, okay. So you don't know what to do either. That makes me feel so much better. And we called Carl and he knew all the things to do. But yeah, like just that confidence of like, you can reach out to people.
Yes.
And that made me feel like not alone with all the imposter syndrome. Like that lead by example thing I think is so important. And it was definitely showed to me very early on.
And no supervisor knows everything except for Carl.
Yeah, he knows.
Carl knows it all.
Yeah, everyone knows it all. Yep.
No, I think that and I love the human aspect that you're speaking to, like the safety, the connection, the humanity. And it was fun. I've stayed connected with several of my supervisees over the year. And just yesterday, I have one that texts me every Mother's Day. I hear from him every month and all the other holidays. And he lives in DC now. I was in DC a couple last year and we got our kids together. So just love this man. He's wonderful, but we've stayed together through all of those like ups and downs of employment and challenges. And then he went on to greener pastures and I'm so proud of him. But I think all of that just speaks to like that crux of the authenticity and safety within our relationship. And it's evolved now. Like I'm not a supervisor anymore, right? Now we're friends. It's a very different relationship we have today than we had 10 years ago. Man, he drove me fucking nuts 10 years ago. I mean, I remember like having to pull him into an office and close the door and be like, what did you do? And like him mad at me and me frustrated with him. But it was genuine, you know what I mean? And we could show up and disagree with each other. And even reflecting on some of my own supervisors throughout the years. And I often joke, I think I even did a leadership about it not that long ago, about how all my mentors are dead. Because many of my early career supervisors have passed away since, but stayed connected with them and would see them at conferences from time to time, or like they're very real relationships that they're not just professional relationships until I got that signature on my documents at the end of the day, and vice versa. And I had relationships that weren't so safe and we didn't keep in touch. But you know, I think for the most part, the supervisor relationship is intended to be, just that space of safety where you can go in and lose your shit and discover something about yourself in that moment and take that back to the clients you serve.
I would say, speaking directly to that safety, one of the greatest things starting out in supervision, one of my supervisors, she said, this is a space where you don't have to have it all together. This is a space where you can fall apart if necessary, where you don't have to have the perfect responses and the perfect answers. And that was the first time I've ever heard that, where you don't have to be perfect or know what to say or know what to do. So that was truly the start of like it being a place where I can just be.
But how difficult is that for so many of our early career clinicians, right? Like I went to school with folks that if they got like a B plus, that landed really hard, right? So, and I think there's so much competition in our field in terms of education and practicum and internship. And so we almost indoctrinate, that's a harsh word, but I'll use it. I'll let it go. We almost indoctrinate early career professionals to be perfect so that they're competitive. And then you finally get your first like master's level role. And we're like, you don't have to be perfect here. And I've had quite a few supervisees like look me dead in the eyes and like, what's the catch?
There's the catch.
What's the trap? This is a trap. I don't trust it. And so it almost makes me wonder if there's not a way in which our field needs to better prepare our folks so that they can use supervision more effectively and don't have to white knuckle it, which I think often leads to like that burnout piece that is so endemic in our field.
I've seen personal stories kind of impact that as well. Like for me, my supervisor relationships when I got into this field were some of the very first healthy relationships I've ever had, and so it was really challenging that the role I had played in my life for so long was like, I had to be that. And so when I met my supervisors and they're like, no, you can still be really good at what you do and not be perfect. And that's totally fine. And it's like, wait, what? But I've also ran into that as a supervisor where supervisees have that block and that barrier because that's been the only role they've ever known their whole life. They have to show up like this and it's not safe or it's scary to like be vulnerable. And so having to like help guide that because that shows up in the therapeutic space as well. And so it's an important supervisory aspect to work on, but it's hard when like that's the only role that you've known in your personal life, and then that's also kind of what's being shown in school or your programs and things like that.
Yeah, I'm trying to think because I've had that supervisee that's like, everything's good, it's fine. It's like, you just lost a client to overdose, or we just hospitalized a kiddo, an 11-year-old on your caseload for disclosing a desire to die by their own hand. Like, you're not okay. Or like, this is a perfectly acceptable place to not be okay. And yet I think sometimes our own stories, our own person of the therapist pieces lead us to be that, no, I'm perfect and I've got it all together and I did these things, but then or just quiet, like that suffering silently, that white knuckling it. I remember one of my supervisees, who I just loved working with this guy. He was fantastic and he went on to other things most recently, but I remember early in our supervisory relationship asking him like, well, how often do you cry after work? And he looked at me like I had 11 heads. He's like, what do you mean cry? It's like, well, you work with problematic sexual behavior in a fairly impoverished county where you're hearing you are inundated. And he had a huge PSB caseload, one of the biggest we've ever had. And I remember when I first started working with that population, sitting in a room of adults that went around the room and introduced them. Hi, my name is Joe, and I, molested my stepdaughter. And hi, my name is Kevin, and I raped a 6-year-old. And like, it just goes and goes and goes. And it's like horrific stories that if you have to hear them to serve this population, but depending on what your own story is, it's going to land really hard. Just being a human, and even if you've never had a non-preferred sexual encounter, like that's a heavy thing to carry. And it's so often it's very difficult to support a supervisee in taking it from that clinical skill-based development to that person of the therapist exploration. And then also as a supervisor, there is that line then where it's no longer person of the therapist supervision. This is something that's too big for that space, and I need to encourage you to get into your own therapy. And that's a very long and winding and tenuous road. And I don't know where the checkpoints are to say like, oh, this is when it goes from skills to your shit.
Right.
This when it goes from your shit is too deep to you need to get into therapy. And I wish there was a clearer rubric for that, but I have yet to figure it out.
Yeah. And I think oftentimes we don't know.
Yeah.
We don't know until we're there and we start talking through it. And then like you have that moment and you're like, oh, shit. One of my supervisors, Deb Thomas, she wants to write a book, Whose Shit Did I Step In? And I'm like, yeah, like I've had those moments where I'm in supervision, I start talking about things and I'm like, oh, what did I just like come upon? And I think also then I've seen like my supervisees do that as well. And those moments sometimes happen in the toughest times because like in family-based, we have team supervision. So you can see that like deer in the headlights, oh man, something just happened for me. And it's like, is it safe to pull that thread at this point? Or do we schedule an individual time? And I just recently had an experience with some supervisees where they had this like moment, and just luckily I was able to then talk to them a little bit later on. They called me for an unrelated issue, and I was just like, how you doing? And we were able to kind of talk through some things. But I think you can only do that too when you hinge on your relationship. So this supervisee and I have a good relationship. I think, but we have a good relationship. And so it was easy to kind of go back and just make space for that moment. And then to be able to say like, okay, now, do we need to make more space for this? And talking to your point of like, are we going into therapy or are we staying in supervisor-supervisee relationship? And so it's like, do we need to make more space for this right now? Or is this something that we just need to have in the back of our minds as we're navigating different processes? And then if it does continue to be something that shows up over and over and over again, let's talk about what next steps are from there. So that's just kind of one of my recent experiences. I'm a relations therapist, family systems, couples, family therapy. And so I believe that having that relationship is super important for burnout, for processing, for staying in the field, staying in some of these really tough jobs. And then I've always appreciated the relationships that I've built to be able to say, like, if I find myself in a moment, I know that I have several people that I could call and I could just reach out to if I need help. And I strive to be that supervisor.
Yeah, you mentioned burnout in there. You also mentioned like one of the things that I often struggle with, or that I found that I struggled with early on, is I would emulate my supervisors. Like I didn't yet have my own professional identity, so I would walk in and almost adopt someone else's professional identity, and that can take you so far, but eventually it gets clunky, right? Like most of my supervisors have been like older white dudes. Like I'm a 24-year-old female that It's different. It lands different. It looks different. I worked when I came into the field of doing problematic sexual behavior work or addictions work, the vibe was more of like chair over the head therapy, where we would just beat you with it until you would change. And very quickly, I realized like I am working with individuals that could snap me like a twig. And I look like if I emulate that particular provider, I look like a chihuahua yapping at a Doberman. Like it's just silly. It doesn't work. So very quickly I had to pivot and I'm glad because I don't think like coercive therapy is effective anymore. And I think our field has really shifted from there. But I remember early on being like, well, I just so look up to him. I'm inspired by him. I need to be him. And then being exhausted because I couldn't do it. Like I often was found wanting and had to eventually like abandon my belief that I'm going to be that guy and accept that I'm not him. I'm Kim Ernest. Well, I was Kim Smith at the time, probably, but I'm me and I'm going to have a different style. And I need to lean into that versus trying to be that dude.
Yeah, orientation, Carl literally said, you got to show up as yourself. That's the most important thing you bring to the table. We don't need 40 Carls. I mean, that would be really cool.
That would be really cool.
Oh, yeah. I would hire all of them
Yeah,
tomorrow.
all of them. Yeah. Just have one at each clinic, just hanging out. Yeah.
Giving people fist bumps. And high fives.
It's going to be fine. Everything's going to be fine. Yeah. But no, like that's one of and startup is hard. So I don't remember a lot of it, but I specifically remember that piece of him just saying like, you're good enough the way you are, just show up as that because that's what forms those relationships. You can form relationships with people that no one else can't because you're the only you. And that just has stuck with me. And it's something that I definitely, the minute that I start working with a new therapist, I remind, like, don't try to be like me. Me doesn't work with everybody. So like, be yourself, show up as yourself. And that was just really great advice. And I think it's helped reduce burnout. With the population that I serve, a lot of trauma, addiction, long-term prison sentencing, that's hard work. And just not having that pressure that I have to be someone else or that I'm not good enough as me, that has allowed me to do this for, going on 8 years without feeling like, oh my God, what am I doing?
I would say having a supervisor who kind of plants little seeds of like, hey, how would you say it? Like, yes, this is how I kind of role played it with you, but how do you want to say it? And just that little seed over time and you get those small wins, I can say as a supervisor, that has been really helpful because now, when you're a supervisor, you look up to everything around you when you know that they're competent. And I'm like, all right, this is what I want to do. And then sometimes you might go try it and you're like, okay, it didn't work. And then she's like, well, how did it go? Let's see the recording. And then I was like, this is where I could have went different. This is where I could have done something different because I wasn't showing up as me. And when you're in clients' homes and working with families, you really do have to show up with you because they're showing you all of their things literally when you go in their home.
Yeah. Sorry.
No, finish your thought.
I was gonna say, and certain populations look for that. Like they can tell if you're being fake. So like the second they see that you're not showing up as like authentic you and you're trying to be someone else, their trust issues are gonna like come like flying to the surface and they're gonna shut down. I see it happen all the time. So I think that's just like another important part of that, especially in family work.
Yeah.
I'm sure they're all on edge, you know what I mean? So like they have to be able to trust that you're there for, showing up as you and not have like ulterior motives.
Yeah, that could get super exhausting. I think we see families in our program 6.5 hours or more per week. So if you don't show up authentically and you're putting up a facade, you are doing that for a lot of hours, a lot of the time. And I think it goes back to not wanting to seem incompetent, not wanting to seem like, you don't know what you're doing. It's your first week, even if it is your first week. And something that I always say is like you showing up for clients, whether it's in their home, in the office, is already an intervention. You just being able to sit there and listen to them, and you may be the first person that's ever given them the time of day to be able to share their story. That is life changing for a lot of or for a lot of the families, a lot of our clients that we work with.
I think, Mel, you're identifying this need to just be present with the client. And you can be present and you can be authentic without overly self disclosing, without telling them your whole story. I actually think that's quite dangerous. But I think oftentimes clinicians, especially early career clinicians, mistake self disclosure for authenticity. And I think that's a really like sticky wicket to get into. And often encourage providers like show up as you because they're gonna know if you're not. And they will not trust you and they will not like you. And they might not know who you are, but they'll know who you're not. And I think that sometimes our authenticity can be a liability in the absence of using some sort of model or therapeutic approach. Like, I think that makes me worry. I often worry about like the population you supervise, like our peer support specialists, our recovery support specialists, because they certainly have training and certification, but compared to like a therapist, they have significantly less training, and they often, I believe, and you'll correct me because you're closer to the position than I am, but they encounter so much more. I feel the same way about like our bachelor's level family-based therapists. Like oftentimes they come in with very little training. And we get them trained and we give them supports and we give them resources. But what we notice is that many of them, at least in our bachelor's level roles, we watch them wash out within the first like 6 to 9 months. Like for some of them, they have really good intentions. They really desire to serve this population. But when they get into it, they start to realize there's a gap between their skill set and serving this population. And so they insert themselves in the middle and almost pour themselves into the client. And that's a liability when you have a non-preferred client outcome. Like I have enough training, I have enough supervision, I have enough like certifications and letters after my name that if I lose a client to overdose or suicide, both of which I've navigated as a professional. And I will tell you, those have been my worst fucking days on the job. If we hovered here long enough, I would start crying for sure, because I cared about those people on a very human level. But at the end of the day, where I could find comfort is that I used a model that is intended for this purpose, that has helped thousands of others in similar ways. Like one of my hardest overdoses was a client that I had seen for years. I'd done CPT with. We had addressed his trauma up one side and down the other. And he got a bad batch and that was it for it. You know what I mean? Like it just was what it was. And it was a really sad narrative. And I grieved him on a human level. And when I went back through his case, I wasn't a perfect therapist because none of us are, but I was a good enough therapist and I didn't have to hold that personally. But I think our early career clinicians, our bachelor's level folks, our peer specialists, those who operate from that peer model, I think they hold it heavier almost, or they have the risk of holding it heavier, I suppose.
Yeah, I mean, when your role is completely centered around lived experience, which one of my certifications is that, a family recovery specialist, it's really trying to draw that fine line between showing up authentically, sharing your lived experience, but also still coming to that session in the best interest of the person you're serving and not just to tell your story. And a lot of individuals with lived experience, they don't get the best kinds of supervision, and that leads to burnout a lot because they struggle with imposter syndrome too. They're working around a lot of clinicians with years of education, and 5 years ago, they might have been like shooting dope in Kensington and Philly. So like you talk about imposter syndrome, it's one of the heaviest pieces of that role. especially if they're working in places where the clinicians don't understand the value of their role. And so they are treated like as a separate entity or outsiders when their role is so vital and so important to what we do as clinicians. And so providing them that feedback of you're going to run into a lot of weird shit. One of my supervisees, client came in and said, I'm done, handed him a needle and drugs. And that was that person's drug of choice. You know what I mean? And so, like, there you are as someone in recovery and you're being handed your drug of choice to dispose of. You know, like, that's, if that person didn't have a supervisor to staff that with over the next 6 months, you know, like, that's a heavy weight to carry on themselves, and to ask themselves, did I do the right thing? Did I help that person? Did I serve that person in the right way? And so lived experience is an asset, but if it's not treated in the right ways, it can definitely become a liability, not only to the populations we serve, but to the person and their own recovery journey.
I find myself very curious about other ways supervisors can support developing a healthy clinical identity that I mean, I think stress and burnout, truthfully, is part of our job. I don't think it has to end there. I don't think you have to stay there. But I think to say that if you work in this field for a season, that you'll never be stressed out, you'll never struggle with burnout, you'll never have negative feelings about your clients or your profession or your like, I think that's just Pollyannish. I think that's silly. I think we all get there at different points and different seasons. And I can remember having supervisors that are like, you need a day off. I can also remember supervisors that say, like, no one cares, try harder. You know what I mean? Because I also had those supervisors. And I can remember very critical points in some of my different supervisees' development over the years where I've had to say, like, hey, we're going to take this client off your caseload because we've done supervision around it, but you are carrying it in a way that I think is dangerous for you. And so I'm going to make the supervisor, I've told my supervisees, if I get one fucking email from you over this weekend, you are in big trouble Monday morning. I don't want to hear from you. I want you to clock out. I want you, like, you need to take time to yourself. I've canceled supervisees' days and been like, here's some PTO, go take off. So, I mean, I think that I've like done some of those very like short-term intentional pieces, but I'm curious about what y'all have discovered about ways in which we can support our clinicians in developing a clinical identity that is protective against stress and burnout, realizing it ebbs and flows, right?
Yeah. I mean, I think boundaries.
Yes.
Gosh, I'm like, if I had $1, and truly my supervisees, every time I'm like, boundaries, or like I say the word boundaries, they're like, ugh, like, there's Mel again with the boundaries. But it goes deeper than just don't answer your phone, don't check your email. We have on call for a reason. So it goes back to the like why, finding the why behind the lack of boundaries, or feeling like I need to be present for this family. Oftentimes there's an activation behind it. I think it goes back to stress and burnout goes to success and what we measure as success in the clients that we serve. We oftentimes are like, if they don't leave here perfect, then we failed. Or why did they quit therapy? Why did they fire us? We worked together for 6 months. And when I've had moments like that in my own career, I've gone back and I'm like, because their goal when they came in was this, and we achieved that 3 months ago. And then I invited myself to continue this other work because I felt like that was important to the client, but it wasn't important to the client at that time. And so I think like boundaries and boundarying ourselves and being able to measure what is successful, and truly meeting the client where they're at. If they're not ready to dig into something, and we're so ready to, oftentimes that's when we lose them.
Yeah, Crystal is another one of my awesome supervisors. She talks about ladder rungs and how for all of us, whether it's supervisees, whether it's our personal lives, there's times where our ladder rungs are really far apart and our next step is a big step. And then there's times where our ladder rungs need to be didn't drink 12 Dr. Peppers today.
Only 8.
11 and a half.
Yes, did that. I ate lunch today. I went to the bathroom 3 times today. Like little on depending on the day, those rungs are really close together, and that's the same for our clients as well. If we want them to do these giant leaps, that might not be what keeps them in services. Sometimes it's just not committing a crime for a year. That's a goal.
I remember that was something that I really struggled with early on because I would often have really grand plans for where my clients were going to end up. And I remember having a supervisor because at that time I was doing a lot of vocational rehabilitation. So I would do the evals and then we would identify what mental health pieces were impeding their ability to be a part of the workforce, and then we would assist them with those pieces. And I would come up with like these lofty goals. Like they're gonna get an associate's degree and then get a bachelor's degree and then go on to be a physician's assistant. And my supervisor at the time was like, well, maybe, they could start with a part-time job at McDonald's. Like, could we, and just have that for 3 months? That might be a good starter goal here. And that's always been me. I've always been recklessly optimistic, right? I've always thought like, oh, we could get to the moon. And they're like, no, you can't even walk yet. Like, you're not flying to the moon anytime soon. So I think that a supervisor's role can also be really helpful in helping the clinician explore what if this is my goals and my perceptions for the client and my hopes and dreams because I often am like, baby, you could be fire. And they're like, no, I don't want to be fire. I just don't want to get arrested again. And it's like, all right, baby, you cannot get arrested again. But helping you recognize, I think it's funny. I think we're one of the only fields where having your own shit, having your own baggage can be really helpful as long as what's in your suitcase. You need to know what's in your suitcase. You need to open the suitcase and sift through and figure out, because you could be carrying a bomb on an airplane, right? You don't want to be doing that. But you do really need to know your stuff. But then once you know it and once you explore it, I think it can become a superpower in the work that we do. But our supervisors are what helps us get there. And so I've always been super high achieving. I've always had really lofty goals for myself. And I had to recognize that when I would take those and apply those to my clients, what I thought was inspirational, I was discovering was really discouraging because I was asking them to do something that they couldn't even begin to conceptualize was within their sphere of attainment. So, I think it's helpful to those ladder rungs. I've used Crystal's metaphor for that many times.
Yeah, I see so much potential in all the people that I work with, whether it's supervisees, clients. And so I got to reel that in sometimes. because I set ridiculous goals for myself doesn't mean that that's healthy for everyone else in my life.
Mm-hmm. Yeah, as a supervisor, I'm like, okay, I'm going to give you the model real fast, okay? And then you're going to go out and you're going to apply this model to this family. And then they're going to be amazing in 8 months. And then they come back into supervision and I'm like, so did you try the thing? And they're like, well, when we got there. And then there's a story of how that thing that I was like, go do this will be awesome, was not in alignment with what the clinician was ready to do, what the family was ready to do. So I to turn to your point of, I have to pause myself in supervision often and be like, are you teaching? Because I'm a trainer by trade as well. So are you teaching or are you helping, are you supervising? Are you helping them to build through their own experience, through their own knowledge, taking the things from training. But yeah, I feel like I have to really check myself so I'm not then also being finding myself, I guess, in a frustrated spot where I'm like, well, I told you to do all the things. One thing I have stopped myself from doing is going to sessions with my supervisees. I do, but I don't go to have the hard conversations anymore. I did that a couple of times and I was like, what are you doing? About my third time, I was like, what am I doing?
That's so hard, though. It's
It
so
is,
hard to
yeah.
because you love your supervisees
Right.
in like a clinically appropriate way, and you want to care for them, and you want to.
Yeah.
And so when they have like these little baby faces that they show up with now, and you're like, let me help you, and then you realize you're not helping them; that they're grown ass, fully fledged adults.
Yes.
And you're infantilizing them and impeding their development, and then you have to
Yes.
beat yourself up about that for at least 7 to 10 business days.
Yes,
But
yes.
that has always been the hardest thing.
Yeah. Yeah. When families call in, they're like, can we speak with their supervisor? I'm like, you could speak with me, but I want the team to be present because this is a collaborative process. So I think giving the skills and working the muscles is something that helps, again, stress and burnout.
And it decreases codependency because, like, the goal is to work ourselves out of a job someday. Like,
Right.
so I'm going to teach you a skill and then I'm going to encourage you to go master it. And you're going to probably stumble a couple times, and that's cool. We all do. But, like, you got to master it on your own, because if I'm just coming alongside you all the time and doing it for you or walking you through it, you're never building that confidence that you are capable of doing that. And I believe in you. I believe that you can go do this on your own. And I'm grateful for that early on, in my own supervision. I was like, I want to start a trauma group for men. And they were like, do it. And I was like, cool. And it was like super successful. But like, I thought it was a crazy idea. And, someone believed in me and it happened. So they didn't come do it for me. I had to figure it all out myself. But, I'm grateful for those moments because it taught me to like face my fear, move through fear, and then show myself what I'm capable of. And I think that's an important lesson for our supervisees. It's like, no, we believe in you. And although you hate me right now and you're going to go back to your office and you're going to probably text your family and tell them I'm an evil bitch from hell because I'm making you send your client to rehab, and they don't want to go and their PO is going to be upset with them, you will thank me in 2 years from now.
But I think that's like the best way to develop your clinical identity is to have a supervisor that has your back.
Yes.
Even when that's not maybe what you were hoping for out of that, like there has to be that safety, that security, that those times where you like praise them and highlight all their strengths. But also sometimes a great supervisor is the one that's like, you're not gonna like this, but this
do a
is what
child
I
line
would
report.
do.
Yeah.
You got to do a child line.
4:30 on a Friday.
On a Friday.
And don't forget the incident report.
Yeah, yeah.
Sorry.
And do you want to pull the client in for the child line report? Right? Like,
Yeah, make sure
Yeah.
everyone's cool with it.
yes, yes.
Kim, when you say, I always say like baby therapist, but just having that safety and the relationship with your supervisor as a baby therapist is so important because you want them to bring everything to you, the good, the bad, where they might have fucked up. So then you can really work through it. But if there isn't that level of safety, they'll try and maybe, in my experience, I would have said, I want to like manage things on my own or be perfect, right? I can't show you this because then what might you think about me?
Yeah.
When you have that safety, you're not going to think anything different because you're just here to support me. So
There's no judgment. Yeah.
There's no judgment.
Yeah.
That non-judgment. I often say I think I'm the therapist I am today because I worked for about 4.5 years in a context where if you were in a room doing therapy, it was filming. No client, it was a clinic, a community-based clinic where you paid like $1 a session. So one of the caveats is you'd have a student clinician and everything is recorded. So clients couldn't not consent to recording if they wished to receive services there. And therapists couldn't not consent to recording if you wish to receive your training there. And for my first 2 years in that clinic, I had supervisors that let me bring in my work. And that was cool because I could bring in my good work. Or lowercase p problems, like those mistakes that are I lost my words, and we'd look at it and we'd learn and grow, but it wasn't oh, my forever empty showed up in session and it was a really dark day. But then in my third year, I had a supervisor, and it was funny because I had him for different things throughout. And so I had a really great relationship with him. We had a lot of we had a really safe, connected relationship. I really trusted him. I really looked up to him. And his thing was he decided what we looked at in every supervision. And so he would open my list of recordings. He would pick a client, and in the background, he had a sixth sense. He could claim he could read auras. So he said he could see auras, and I think he just knew. He knew, somehow he had little, elves that ran throughout the clinic and reported back, she fucked up on this day, right around minute 11:25. And so he would open a session, he would open a client, and I'd be like, oh no. And then he'd open a session, I'm like, fuck. And then he'd open the moment, I'm like, ah. But I learned so much from him just picking my dark, and he had a spinal cord injury, so his hands were like this, and he would slap my leg, what are you doing? But we had such a good relationship that it all felt fine, you know what I mean? And I grew and learned so much through that process. And so I think the tape, to speak to that, I know a lot of our clinicians are reluctant. I know our clients are often reluctant, but I am such a huge proponent of filming everything. And so even today, I won't accept you as a client if you won't allow me to film. And I've since changed my perspective that I won't accept you as a supervisee if you won't allow me to film. Because I did have a supervisee once that I had started, and I really struggled with her, truthfully. So I needed the supervision on her. But when I had a supervisee that wouldn't allow me to film, I film my sessions, I film my supervisions, and you never know when you're going to run into something that you don't know what to do. And so to have that camera always rolling, one, people get used to it.
Right.
And they forget about it, and then they show up more authentically. But two, when I find myself at that place where I'm like, oh, holy cats, what is happening here? Mm-hmm. I then have it, and I can take it in real time to a supervisor, or I ended supervision about a year ago, but to a colleague and be like, look, what did I do? What went wrong here? Mm-hmm. Or even just watch it back myself and be like, oh, I didn't have permission. I proceeded without permission. Mm-hmm. There it is. I see so much watching back my own tape.
Yeah. Yeah.
What about the bad supervisors? If y'all ever had a supervisor that was holy canola? Because I've learned a lot from them too.
Yeah.
Mm-hmm.
I've learned a lot from them too. I use the example of the supervisor that would yell at me a lot and would draw sinking ships on my reports when I would turn them in, and right, what were you thinking? Or this is a mistake. Just my papers would come back bleeding from her. I remember one group supervision where I didn't paginate my report, and she threw it in the air in front of all of my classmates and colleagues, and I had to crawl around on the floor and gather up my papers and try not to cry. But I've cried in every supervisory relationship except with her. And one of her long-term supervisees actually pulled me aside, and he's like, if you cry in front of her, she'll be less mean. She's just trying to break you. You need to cry. And hell I will. I'm not crying. And I didn't. I never cried. Yeah. With her, I still learned a lot, but I learned a lot the hard way. And so I guess while safety is not the crux of the work, I definitely didn't do any personal therapist work there because it wasn't safe.
Yeah, I think when your heart guides you in a direction that's different than your supervisor. So, I have worked numerous different levels of care prior to coming to PA counseling. And I had a role where I just wasn't in love with it. It was a lot of like assessments and there was another component of the role that I really loved, which was a lot of crisis management, high risk clients. That was my jam. Yeah, right. And so when I had to stay within like a black and white line, I hated that. I felt stuck. I felt kind of tied down. Like I can see more. I want more. I can do more. And I had a supervisor who was like, no, stay in the black and white lines. This was really early on in my career. This was like back when I finished my master's. And I just remember going home just being like super frustrated because I've always had the eye for like my degree is in infant mental health counseling, which is not laying infants down on a couch and talking with them. I came to find out my second year. But it's all about family systems. And so I've always had a big eye and big heart for working with families. And this role did not align with that. And so I can get super bullheaded. So I just found myself getting like really bullheaded about things. And then I was like, leading back to stress and burnout. So then I felt super stressed all the time. I felt like we're not meeting these clients where they need to be met. And then eventually it was just like, well, that's not what the role is. So then I had to pull back and be like, well, if I want something different, I got to go find something different. And so I think some of the toughest, and even being on the supervisor side, some of the toughest relationships I've navigated is when the role isn't a fit. And so it's like, well, we work with the whole family system. We work through the ecosystemic structural family therapy model. We work with the system around them, like the school and probation and all of the things. And where their heart truly lies is in that individual therapy in a mutually safe space. And so I'm trying to put like, the circle in the square, and it's not working. And it's not working for either one of us. So I think kind of on both sides, it's just, where there's not an alignment. The role isn't a fit.
Yeah, I think I had a similar experience. I was a CO, and I did that for like 3.5 years, and it very much was same. This role is not for me. Like I'm here to have like, authentic relationships with people and not judge them and not like treat them as they're less than human because they made a mistake, and they ended up here. And then the amount of mental health and addiction that was with the prison system, it just felt like very like an ethical pull away from like what, and it, to your point, like you either get bullheaded and you double down like, I'm going to make change here. Right. And it's like, well, no, because it just isn't the right role. So like, let's go back to school and accumulate more student loan debt. Why not? And so like that led me into therapy, and it's like, this is where I belong. Mm-hmm. But not every supervisee that I work with is going to have that same moment of like, this is it. This is where I belong on this planet. And if they don't, like, that's okay too. And we're going to cause damage to the relationship, to ourselves, to them, to clients, if we don't recognize that, I think, early on, and encourage them to maybe try something that would be a better fit for them.
Yeah, definitely. That's kind of like, I do interviews, and that's kind of my selling point too, of being in like a larger organization that has multiple programs. It's like, hey, you think that this is where you want to land, and I love that because truly I'm biased towards family-based. And I do outpatient, I do, all different things. But I always tell them about just coming out and having the conversation. And I speak that through my own experience. Like, I've been in roles that I've absolutely loved, and I've been in roles that I've really struggled with. And so being able to just not become bullheaded, and feeling like I have the support around me where I'm like, okay, I finally like need to have the conversation, and just being able to, I grew in my supervisory role because one day I had a conversation with Deb Thomas and I was like, hey, do you need a license to be a clinical consultant in family based? And she was like, no. And I was like, interesting. And then like a month later, one of our clinical consultants, moved on to a different journey. And Deb's like, what do you think? Would you interview for this? But if I didn't have that conversation, I don't think my role would be anywhere near it is now. So when I do hiring and I talk about what within like an organization, whether it's us, whether it's, any organization that has multiple tiers, multiple programs, I just find a lot of value in that. And I think that that's so important in your early career to not just kind of buckle down in like a private practice, unless that's where your heart has always guided you towards, right? But if you're not sure, finding a space where you can try on a couple of different shoes to find the right fit, I think is, I guess, even words of advice for people who are coming into this early in their career.
No, I think that being in the wrong context or trying to fit into even a therapeutic modality, like if you have a supervisor whose therapeutic modality does not align with how you conceptualize change, I think that is a recipe for burnout. And it was funny. I was actually thinking about for the next family-based training that I do, which I don't think I have any more this year. I need to confirm that with someone who is a better organizational person than me, but I'm pretty sure I'm done for the year. And I was kind of disappointed because I was like, oh, I have an idea I want to do. But I think I'm done for the year, but I would love to do like a therapist burnout bingo card. And like all the things that like if you do these things, like get 5 in a row, that's a bingo. And I think like having a supervisor that doesn't feel supportive to you, whether maybe it's nothing wrong with the supervisor even, but that like their goals aren't your goals or whatever, if that's misaligned. I was thinking about your clients at 3 a.m., working through lunch, never using PTO, never turning off your phone. Like there's all these different things that I think for sure will take you down the road of burnout. But I think one of the big ones is that mismatch with fit between clinician and supervisor. So when we think about and sort of as we wind down here, I find myself wondering, like, if you could share a time where you had a supervisor that supported you or sort of got a hand at your back when you were struggling with burnout, or a supervisor that helped you kind of rediscover your spark for the work that we do.
Well, very early on, in my work as a therapist, fresh out of grad school, I experienced some significant loss, and then more significant loss. And I just remember, like, one of my hardest things was I see this client every week at this time, and that's also the time where my brother ended his life. So every single time I see this client, that's what's going on in my head. And I love this client. I don't want to associate with that. And Carl's like, just change the time. And I'm like, duh. But like just the amount of, from like literally at my clinic up to headquarters, the amount of supervision and just comfort and just like people reaching out, donating PTO, I've never felt more supported in my life. And that was the only reason I was able to like return back to work, show up for my clients. I didn't have the luxury of taking a bunch of time off for either of my losses. And to be able to show up and still be present in the therapeutic space and do my job, that's so important to me and probably saved me during those times as well. Like without that supervision, it wouldn't have been possible. And they just really came, whether it was to just like, let me talk about the suck and sit there with me and cry with me, or it was, an easy solution to a problem that Carl just
Change
happened
the
to have.
tone.
Yeah. But like those things were like, if I didn't have that, I don't know what would have happened to my career trajectory because it was so early on. I was still really trying to learn how to show up in trauma work and do that kind of stuff. I was running a men's trauma group. So it's like, how do I show up in these spaces and still be an effective therapist while also navigating my own loss and my own trauma? And that the supervision, I definitely like single-handedly, that got me through that.
Yeah, early in my career at PA counseling, I was an outpatient, full-time outpatient, seeing individual clients, doing some groups, and I had 2 young kids. I just had a baby, my second, and I had a 3-4 year old. He was going on 4 years old. And I remember trying to navigate my life with very young kids, and essentially doing it all on my own. And so I remember going into Deb Thomas. She was my LPC supervisor at Ren, and I remember saying, like, Deb, I don't think I can do this. Like, the work isn't fulfilling me. I need flexibility. I'm feeling overwhelmed. Like, I'm not sleeping at night. I'm not, and so then I'm having a really hard time staying present with my clients in the space because I'm tired, and I'm sitting in like a darkish office. Like, it just wasn't my thing, right? And I was like, I don't know what my career path is going to be from here. Because prior to coming to PA counseling, I worked crisis work, RTF. I was always working with really high risk families, really high risk clients. And I was like, I want to go do outpatient. It's so calm there. And it was too calm for me. I was being lulled. And I remember Deb saying, like, Mel, you love the family work and you love, like the high risk and the crisis and all of those pieces. And she's like, and the flexibility. And so she was like, have you ever thought about family-based? And I was like, what's family-based? Because I also didn't do my research on what PA counseling offered when I first started,
It's complicated.
Yeah. Yeah, that was my relationship status with PA counseling.
Complicated.
Yeah. And so then I came over to family based, and it truly, I mean, in October I'll be in family based for 9 years, and it truly has helped me professionally, personally, the relationships that I have. So I don't know. I probably, at that moment in time, I might have even completely switched paths. Like, I was throwing around like different things. My parents own a business. I was like, maybe I'll just go do that. And I was like, and so having that supervisor who had the solution, but also heard me out for several, like, it wasn't just like I had a bad day and I just showed up and I was like, fuck this, I ain't doing this anymore. Like, allowed me to kind of work through my process. It was also a little like controversial at that time because people were like, wait, like, you want to go from outpatient to family based? Like, I don't know if anybody's ever done that. It's like, but I think it also set like some really good like stepping stones again, like that I talked to my supervisors about, like, go try like on a different shoe if this doesn't fit. So that was just really meaningful to me because I think it just like solidified where I'm forever going to be.
I would say having, and I wouldn't say it helped me prevent burnout. Because when I reflect on it now, I'm like, I would have went down a super terrible path. But just going through, sometimes as a supervisee, if you see supervision this way, it's like, all right, it's this hour and a half at this one time. But when you do have a strong connection with your supervisor, they are on call basically. Like, like, if you don't have to just be in my office, you can text me, you can call me, whatever like support you might need. And I remember going through a part of my house had like caught on fire at one point.
Oh my gosh.
And I showed up to work the next day, me just doing what I need to do. And I'm trying to like submit treatment plan invites and do different things. And my supervisor was like, go home. Just flat out. Like,
I don't want to see you.
why are you here?
Yes.
Like,
Yeah.
why
Get
are
out
you
of
here?
here
Just go
immediately.
home.
Yep.
Yeah.
I was like, no, but I gotta do this. And like, just go home. Like, you have the PTO. You're fine. You're fine. Just go home. And I feel like that was like so important for me because one, it showed me you really see me as a person.
Yeah.
You didn't put the treatment plan invites above me as a person. You didn't put like you see me. And I really feel like that's what matters. And I feel like just the supervisor being able to share that experience with me, it also helped me be able to share that experience with families of like, I see you. Like, sure, I might have gave you this therapeutic homework assignment, but life happened.
Yeah.
So just remembering that, because if I didn't have that experience, who knows if I would have just kept that mindset of push until I hit burnout.
Well, that was my experience in many of my other jobs before coming here. So the first time a supervisor was like, leave immediately, go home, order food, don't come back until tomorrow. I was like, I'm not going to get a point. Like, you're not going to fire me and like hold it over my head for the next year. It was just very strange to me. I wasn't used to my mental health and my well-being being a priority to my supervisors. I would literally, like my first day at PCS, Trish, she was like, this is my cell number. If you need anything, reach out. And I'm like, what? I like froze in the back, stood there. I will never forget that because I was like, you actually care? Like what? And then, yeah, that had continued to be my experience, but it was very different from what I was used to. It was like, no, just suck it up, deal with it, move through it, get through it. And then to have someone come in and be like, please don't do any of that. Just leave. It was very, and then they had like, you said earlier, they have your back. Like, I'm not going to come back tomorrow and have 90,000 things to do because oftentimes they would help, deal with some of that burden that I was going through.
Yeah. Yeah. I think like knowing you as a person, like there's been a lot of times where I've navigated some tough stuff and I'm like, I actually want this stuff. Like, you could just give me a little more because, like, me as a person, like, I do better when I'm distracted. Yes. And then, like, I'll tell you when I need, like, my moment. And what I really have, like, just valued and a lot of the supervisor relationships that I have is, like, they know that that's how malfunctions. And then, like, when I need to, like, say, hold on, I need to feel this or I need to, like, do this thing, then I communicate that well. So I don't feel guilty of like, okay, now I have, right. Yeah. So
I think that's a testament to like good supervision is knowing the person. Cause like Kelsey and Crystal are great with that. They know that I'm like neurotic and I gotta be at work. That's what keeps me healthy, but they're also not afraid to be like, go. You can't even see straight. You have such a bad migraine. Leave immediately. So they're not afraid to call me out when I'm being ridiculous, but they also know that I function from like a pretty neurotic place. So
I also think though, and I think as supervisors, it's our responsibility. And then you just mentioned 2 supervisors that I know practice that. Like, there are times where your supervisor needs to lead by example and say like, hey, I'm going to go be with my kid this week, or I'm going to go prioritize this other non-work thing. And I remember early on, I had a supervisee that said, Kim, like, you're telling me that I have permission to do these things, and yet I still see you here at 9 p.m. on a Friday. And I'm wondering if like it feels like a trap. Like it feels like a trap. You're saying like, hey, don't worry, you go, but I'll be here. And I struggle to trust that. And I took that to heart. Like, and since I've started like being more intentional about, I mean, I still work a million hours a week and do whatever, but I also prioritize my outside of work values at times at the cost of work. And people see that and they notice that. Like, if I have a migraine where I'm like just struggling not to vomit, I will send an email and be like, hey, I'm non-essential today. I'm not going to be there. I still try to power through if I'm essential, but I've learned the hard way. I remember like puking outside the courthouse when I had a testimony once, and like all these officers just looking at me and then having to walk in and testify, and they're in the courtroom, and I'm like, I'm sure they think I'm like an alcoholic or on drugs or something, and really I just have a really bad migraine and nothing's working. But so it doesn't always work out too when you power through, because I'm sure my expert testimony meant nothing in that moment. But I think supervisors need to take their own medicine sometimes. And I think we need to demonstrate that, like, listen, I love the work that I do and I care about my clients, but when my 9-year-old gets the chance to be in a movie, I'm taking off next Monday. I'm death by meeting that day, but I'm going to go be with my 9-year-old that day because it's important to him, and we're going to make a special week, like 2 days out of it. And like some of those different things, I think our supervisors need to demonstrate it as well. And I've had the pleasure of working with Crystal and Trish and like other working moms that have shown me how to be a mom that works and does this stuff and like some of those different values. I've also had supervisors ask me the really hard questions and bring me in contact with some of the painful stuff, and not coddle me or infantilize me or like have pressed me to consider the parts of this that hurt. So I can think of most recently, I was pursuing my LMFT, passed the test, got all my licensure hours, and then my degree doesn't count. So made a mistake there. So I won't get to be an LMFT. You'll notice those initials aren't after my name, but that's fine. The supervision was so invaluable. And it was so nice to come back to supervision that was only my space with someone who wasn't a PCS person. Like I contracted with Pinky from the Child Guidance Center, our old training center. And I remember having a client that I'd worked with for many years and like cared about him and really liked him, but started dreading our therapy. And so took that into my supervision. And of course she asked like the asshole question of, well, who does he remind you of? And, you know, I'm a supervisor that's asked that question 1,000 times, but we never, you know, we know the things, but do we apply it to ourselves? No, we sure don't. And so she asked me that question. I remember like pausing and then just weeping because I realized that he was really starting to remind me of a client that I cared about that died of an overdose. And so I was starting like my own avoidant attachment style was showing up, which is like, I'm gonna leave you before you leave me. And so I had started with holding parts of myself within the therapy, and therapy that once flowed really nicely was just stagnant and stunted and just didn't feel good. And when she had mentioned that to me, and then we had started talking about like how this guy is not this guy, and his story can and will likely be very different than this guy's, and just sort of hovering there, it was so freeing, and I was able to get back to the therapeutic relationship I was familiar with. So I've had the supervisors that really build me up, and then I've had the ones that ask the really hard stuff and kind of show up in that way. And I think you need both of those, and it's wonderful and beautiful when it's in the same person. Like give yourself space and grace and look at this thing because it's getting in your way. And I think that's a balance that is difficult to strike, but beautiful when it happens. So before we end here today, is there anything left unsaid? Are there any other parts and pieces that we failed to get to here today? Y'all, I felt like today just super flowed. I don't know. I had like all these talking points to push us off, and I was like, oh, we got there, we got there, we got there. So anything left unsaid before we wrap?
I would say one of the greatest things that my supervisor asked me was, do you dream? And in the moment, I'm like, no, I just plan my life out and just go. Like, that's how it's supposed to be, or things just happen. And when she said, do you dream? She said, like, all right, do it. Like, just like, what do you really want? And, you know, again, having someone really pour into you and like so into you is so amazing, because I'm like, I have all of these aspirations now that I never would have imagined if she never would have took the time to say, do you dream? So that is what I would leave everyone with. Just dream and see where you can go.
I love that. Thank you. And very essential for supervisors to remember. I think we often joke at times that I want more for the supervisee than they want for themselves. And that can be a really frustrating place to be. And I would say that's something that even at interview, let's say this isn't your forever role. Tell me what that forever role is. And it's my job to decide if this forever role is a functional stepping stone to that, or if I should be trained. Like, as much as I really want to fill this position, I feel like I'd be doing you a disservice by saying this is going to help you get there, because I don't think it will. And sometimes we waste our time as interviewers, or what? I think I set you and Jen Shutterly up today to do an interview where this person doesn't qualify for anything, but they want all of it. And I was like, at least meet with them and tell them how to get there.
Yeah.
But yeah, all those different pieces, helping people dream and achieve those goals, and slowing down to make sure your goals are not their goals. Well, thank you all. Thank you for joining. Thank you to our listeners at home. We have a few upcoming podcasts. I'm trying to think of them off the top of my head. We're doing one. Kristen will be coming back talking about all about doing drug and alcohol work, and the different ways in which that can be beautiful and wonderful and challenging and painful all at once. We also have another panel coming together to talk about doing forensic work and what it's like working it with problematic sexual behaviors across the lifespan. Also very much looking forward to a few other podcasts we have coming up. One all about the therapeutic relationship from the perspective of the client. We have another one looking at cousins and the essential role they play in our quest for happiness. And I think finally we're going to be rounding out the season talking about grandparents and the grandparent relationship. If you have any questions for any of those panels or pods, please go ahead and email Kim at howtobehappyhour.com and you might see your question show up. And otherwise, thank you so much. Have a great rest of your day. Whew. Thank you, guys. I felt like we had a good rhythm today.
Good. I'm just over here
Love that
destroying
rhythm,
this
yes.
very nice table.
I am mindful that I forgot to print out new billable forms for you all. So, Kristen,
I still have.
You still have yours?
Yeah.
Just send me a new one.
Yeah, okay.
I will make sure to send you one. I'm going straight from here to a conference.